Hello, everyone. I hope you have been with us with this conversation around World AIDS Day. Again, I'm Darlene Nipper with the National LGBTQ Task Force. I'm joined here again with Michael Kaplan from AIDS United. Thank you again.
Thank you.
So great to have this conversation with you. We're going through the theme of World AIDS Day this year, and we've talked already about focus, but the other part of the theme that we haven't talked about yet is partnering. Mm-hmm. And we know that that's so important, Michael. Mm-hmm. What are the kinds of partnerships that we really need given the complexity of the issue right now?
Well, and so earlier we talked a lot about kind of all the social, political, kind of all those connections that work in community that we need to focus on. But one of the biggest new partners that I think we need to bring in terms of health outcomes for LGBTQ folks and HIV specifically is healthcare. And here we are at the second open enrollment of ACA right now, which I think has changed the landscape about what we can do more than ever in terms of treatment. As of prior to this year, about 30% of people with HIV had coverage, and the rest were really struggling with Ryan White and other programs. But we have over 30 treatment options today. We had one when I tested HIV positive in 92. So we've come a long way. The treatment options are really quite tolerable. I mean, I've been diabetic for decades in HIV, and it's not hugely more complex. And the side effects that we once scared everyone away from treatment aren't there anymore. And in fact, the universal guidelines, at least in the United States for treatment, is if you're positive, you should already be on treatment. And yet we only have a third of the positive people on treatment. And so I think we have to do a lot more partnering with healthcare in terms of how to do culturally competent, culturally inclusive, culturally inviting programs that allow people to ask about their status, to access care, and to think about what it can do. But, treatment's not just in the healthcare setting. There's been a huge dialogue about PrEP, and I assume you're hearing a lot about PrEP as well.
Right. I was going to actually say something to you about that because I think there's a lot of misunderstanding in our communities about, well, I don't even want to necessarily say misunderstanding, although I think that's part of it. But I also think that there are lots of issues around people of color and all kinds of treatments. And, of course, something like PrEP brings up some of the old issues that I think our communities have been faced with in the past, obviously.
I mean, how do you trust the government who approved this but also did syphilis testing?
Right, exactly.
Right, exactly.
So there are, just as you say, some cultural issues that actually play into this that we actually have to address in order to make sure that people truly access the
I think you're spot on. And let me step back for a second, just in case some of the folks in our audience don't know, which is PrEP was only approved in 2012, which is pre-exposure prophylaxis, and the idea that a pill a day can prevent someone from acquiring HIV. So we've only gotten this 2 years ago. We have CDC recommending it for people at high risk, and particularly gay men and gay men of color. But right now we have probably less than 15,000 on PrEP in the United States. We're slowly scaling up, and there's a lot of community challenges to trusting it. I will say from the AIDS United standpoint and our partner AIDS organizations around the country, we believe this is a critically important tool in the prevention toolbox. And we believe some of the conversation we're seeing today is very similar to what we saw when we had birth control and talking about judgments of sex in women back then and what it means for gay men and sex today.
Yeah, I see what you mean.
Right.
So actually what I was thinking while you were talking is that now this goes back to what we were talking about in the first segment. So if you haven't been looking,
go back,
take a peek.
Right.
Which is, what is the role, or what is at least, one of the roles for LGBT movement leadership around HIV? And I think when it comes to something like PrEP or even other treatments, this is an opportunity for us to do what we can do in organizations to educate everyone. To make sure that they know what the possibilities are and really dive in on the kinds of conversations that we have, about this issue so that they really recognize and get a chance to learn all of what they need to learn to make the best decisions for themselves.
Yeah, I absolutely agree. I mean, there's so much our community organizations could be doing on this front.
Well, again, with partnerships, we're very excited to be able to partner with you all at AIDS United. It's really a gift to the task force. We think we had a splash at creating change last year, and we're going to keep it going. We look forward to partnering with you continuously, and we want everyone to know that this conversation has not ended. We are definitely going to come back. We're going to continue to talk about the theme for this year's World AIDS Day. So hopefully you will stay with us, and we will talk to you again soon.